Hi guys, my name's Ethan. I'm out here in the Atlanta clinic. We have Drew in the procedure room. He's getting a full abdomen and waist done today. So we're gonna go in and ask him some questions. So let's go. Hello everybody.
Hi.
How's everyone doing?
Good.
Great. All right. Drew, how are you doing, bud?
I can take a nap, man. I'm doing
You
great.
can take a nap?
I'm doing good.
Amazing. Well, it looks like you're already getting some fat out. That's amazing.
Yeah.
How? What areas are you targeting today?
The flanks and the waist.
Flanks and waist.
Yep.
Awesome.
Yep.
So do you want to talk about why did you want to get those areas done?
Oh man, I've had that my entire life. You know, I work out and I eat good, and they're stubborn.
Yeah.
They stick around, and so hopefully this is the last time I have to see them.
Yes, absolutely. You talked about you had them as a kid too, didn't you?
Yep. As long as I can remember, it's just always been an area for me. That's where it goes, is where it stays.
Right. Oh yeah. Well, I think what I've seen also is that a lot of guys have that problem. I don't think you're alone on that. I think most guys have problems. I mean, you're a pretty fit guy too, aren't you?
Yeah. I mean, I work out 4 or 5 days a week, and
Yeah.
you know, we track our food or eat clean most of the time. So just.
Amazing. So it's just those side spots.
That's
for
it.
whatever reason,
They just
diet and exercise does not help with those areas.
very little.
Yeah, it's a hard one. All right, so you're getting the procedure done right now. So what does it kind of feel like?
Like a very light vibration. I mean, it's
Yeah.
like nothing. I mean, like I said, I could take a nap right here.
Yeah. Awesome. So it's comfortable. Just like feels like pressure. I would say?
I mean, not even heavy pressure, very light pressure. Once you get numbed up, you're good to go.
You're good to go.
Yeah. Yep.
Dr. D, how's he doing?
He's doing fantastic.
Yeah?
Really well. We were just talking before you came in.
Amazing. So how do you feel seeing the fat? I know you're a little squeamish. You don't want to look too much at the fat. But how does it feel that, like, you knowing that fat is getting taken out?
Oh, I can't even describe it.
Yeah.
I've had it my whole life, so being on this side of it is just, it's worth it.
Well, you
It's
definitely,
incredible.
look at this. You already have some coming out.
I'm probably not going to look at it, because...
No, yeah, sorry. Not you. I know, you're a little squeamish. No worries. But, I mean, at least you're not in pain. You're
No.
comfortable and everything.
No, I'm doing good.
So what music did you guys end up
We had
listening to?
top hits going.
Top hits?
Yep. Easy.
Just like some pop music.
Just whatever's on the radio, man.
Does that keep you calm then?
Yeah, that's what we normally have going, so.
Oh, that's awesome. How do you feel with the idea of being awake during this procedure?
Honestly, it's fine. I mean, my mind's not even really thinking about it. Just talking to Dr. D, talking to you, and
Yeah.
just chill.
And your wife Morgan's over here. Hi, Morgan.
How you
She's
doing,
just
babe?
hanging out. Yep. Amazing. Well, Dr. D, how much fat have we already gotten out?
So we've gotten 400 cc's out so far.
So what is that like in comparison to a non-doctor?
So can of soda.
Yeah,
about a
can of soda.
soda type of thing.
Heck yeah.
Oh my god.
How is it? Do you like that idea? That you have a can of soda out of you?
Off of my hips? Yeah,
Yeah.
absolutely.
So you already gotten how much fat?
Yeah.
Is he doing well? How's
He's
he?
doing great. He's already fit. And he has a six-pack for his abdomen, but he has love handles, which is very common
It's already
for
concaved in.
in men. And as you can see from the side here, we've given him a nice waist and extended the definition from the front onto the waist.
Yeah, it definitely already looks a lot better.
I can see it.
Amazing. I know. Well, once you're done and all done with your procedure, you can look at it.
Yep, I'm excited.
Dr. D, so why do you like doing AirSculpt?
So I like AirSculpt because it's a proprietary technology where the handle vibrates at a very high rate of speed. And that allows the handpiece and the cannula to do all the work and to remove the fat in a much more gentle fashion than we would with traditional standard liposuction.
Right. Do you feel like that versus traditional, the AirSculpt's a little easier on the patient?
It's easier on the patient and it's easier on me.
Yeah. You get tired, I'm sure, too.
So it's easier on both of us.
Amazing. So what's usually the downtime for AirSculpt?
So depending on how many areas you have and whether you have a fat transfer, The downtime can be a little bit more for those, but for Drew, I would expect him to be back to all normal activity tomorrow. And to
Amazing.
be able to resume working out and exercise within about 2 weeks.
That's awesome.
2 weeks.
That's incredible.
Drew was talking to us a little bit that he doesn't take much time off working out, so this is a fun little vacation for him that he gets to finally get it off. Do you think that how long you said 2 weeks? Does that go along with like lifting too, like just like heavy lifting?
Heavy lifting, yes.
Yeah. Okay, great. And how about how does this kind of like affect? Does this affect the muscle at all? I mean, he has a lot of muscle, so like how does that?
It doesn't affect the muscle at all. It just removes a layer of fat over the muscle so you can see muscle definition better.
Right. So a common question that we do get about that is how does one like avoid hitting that muscle, or how do we like assume that that's doable?
Well, I understand the planes.
Yeah.
So there's skin, and underneath the skin is the fat that we remove with AirSculpt. Underneath the fat is what we call fascia, or covering over the muscle. So we know what the layers are, and we can stay in the proper plane. Also, you can feel if you were to hit the fascia with this blunt tip, you'd meet with some resistance.
Got it. Fun. Oh. So with this type of procedure, how soon can like someone travel? I know a lot of people when they get this done, they usually have to fly out to a certain location or whatever. How soon would you say they would need to wait?
They could travel the next day.
Next day?
Yeah, so
Wow,
if they came in for the procedure, they'd stay overnight tonight and then travel the following day.
Awesome. And then what do you use? What's the what type of numbing do we use? I think people are usually interested on that. Do we use local?
So it's a local anesthesia.
Local, okay.
It's called tumescent, and a lot of people get something similar when they go to the dentist office.
Right. What are some other like common areas that you've seen a lot of male get?
So for male, abdomen, waist area, and chest are probably the most popular.
Got it. That makes sense. Any other areas you're thinking about getting, Drew?
I don't know. I might come back and get my legs done, or maybe
There you go.
a little bit on my chest.
The whole list. Morgan's like, oh no. Well, I just want to thank you guys, and thank you, Drew, for taking the time out of your day to let us do this, and thank you, Dr. D, for letting us talk to you guys. So we'll let you get back to it, but thank you again.
Thank you.
Thank you.
Awesome. See you later.
See ya.